Has anyone had anything so devastating happen, whether it be the death of a loved one or the end of a long-term relationship, that has left your heart feeling like it was being split in two? That feeling where your heart is beating so deep, trying to keep up with this normal rhythm, matching the way we're struggling to get through our days externally? Have you ever had a broken heart? Many artists have referenced this emotional devastation, from Toni Braxton with her Grammy Award-winning song, Unbreak My Heart, and even Alicia Keys with her song, Try Sleeping with a Broken Heart. The reason that our hearts, the phrase broken heart is used is because our hearts are a symbol of where all of our emotions lie. But what if I told you that a broken heart is not just a phrase, but an actual physical condition? I know all of us have felt that pain in our chest during a tragic event or a high stressful moment. Earlier this year, when my 11-year-old cousin passed away from suicide, it weighed on my heart so heavy in a literal sense that I almost felt like I was having a heart attack when I got the news. But what I was actually experiencing was a broken heart. So today I want to inform everyone about broken heart syndrome and how it differentiates from the commonly known heart attack. Let's first start by talking about broken heart syndrome. Now, when we think of a broken heart, we all see the picture of the red heart with the jagged split down the middle. However, that's further from what a broken heart actually is. When we experience a tragedy or a high stressful situation, we sometimes get chest pains and even shortness of breath that makes us feel like we're having a heart attack or a cardiac episode. However, what we are experiencing is broken heart syndrome. Now, broken heart syndrome, medically called tachytubular cardiomyopathy, is a stress-induced condition that causes the failure or dysfunction of the heart muscles. According to the Cleveland Clinic, in an article called Broken Heart Syndrome written in 2018, it states a person's reaction to such events causes a release of stress hormones that temporarily reduce the effectiveness of the heart's pumping action or cause it to contract too forcefully or wildly instead of in a steady pattern. So when we go through a tragic event or go through a high level of stress, our bodies release these hormones called catecholamines. And included in catecholamines are three neurotransmitters: epinephrine, norepinephrine, and dopamine. And these neurotransmitters are part of the sympathetic nervous system. Now, the sympathetic nervous system induces our fight or flight response, which causes the smooth muscles in our vessels to constrict. Now, one of the most sensitive parts of our bodies to the release of these hormones is the left ventricle of our hearts. Now, the left ventricle is very important because one, it's the largest part of our hearts, and two, it has the responsibility of pumping the blood from our hearts to the rest of our bodies. So basically, in a simpler sense, broken heart syndrome is when stress causes a release of hormones that affects the ability of our left ventricle to pump effectively. So with the definition of broken heart syndrome, I bet you can now understand why it would be misdiagnosed often with heart attacks. Now, broken heart syndrome and heart attacks have many things in common. Primarily their symptoms. They both can cause chest pain, shortness of breath, and blood pressure abnormalities. According to an article written by the American Heart Association called Is Broken Heart Syndrome Real?, it states that broken heart syndrome may be misdiagnosed as a heart attack because the symptoms and test results are similar. In fact, tests show dramatic changes in rhythm and blood substances that are typical of a heart attack. Now, even though they have these similarities, there are many significant differences. One of them being the timing of the onset of the symptoms. With broken heart syndrome, these symptoms start almost immediately after you go through your tragic event or your high level of stress. And the second, and probably most important, is with broken heart syndrome, there are no blockages compared to a heart attack. In an article written by the U.S. National Library of Medicine National Institute of Health called Broken Heart Syndrome, Catecholamine Surge or Aborted Myocardial Infarction, written in 2008, it states that tachytubular cardiomyopathy, also called broken heart syndrome, mimics the clinical presentation of an acute coronary syndrome, but without any evidence of obstructive atherosclerotic coronary artery disease, because we know that in heart attacks, one of the main causes are obstruction in the coronary arteries. Now, the good thing about broken heart syndrome is that it's not permanent and it's reversible. According to the article I previously stated, written by Cleveland Clinic, it states that most people with broken heart syndrome recover within days or weeks. There's no permanent damage to the heart muscle, and there's low risk for reoccurrence. Now, let's go over all the things that I've talked about today. Think back to a time when you've gotten the worst news of your life. Your hands start to shake, your lips starts to quiver, tears fill up in your eyes, your breathing gets short, and your heart literally starts to hurt. Because of the stress we're going through, our bodies are releasing hormones that affects our hearts, primarily our left ventricle's pumping ability. We feel like we're having a heart attack because we know that once you hear these symptoms, not far after it comes the word heart attack. And by the time I'm done looking up WebMD, I'm pretty much dying. But all I'm experiencing is broken heart syndrome. We now know that broken heart syndrome is a real thing and that it can mimic heart attacks with the exception of blockages. Now, I know all too well that the emotional pain that we're going through may seem like it'll last a lifetime. However, the physical pain is only temporary and it subsides within days or a week. Now, with all the information I've provided to you today, I want to ask you again, have you ever had a broken heart?